Hi there, this is Mark Ittleman, speech-language pathologist, and welcome to this introduction of the Teaching of Talking training. Our training will help you, whether or not you're a speech-language pathologist, or a caregiver, or a family member, or even a mom or a dad. This program will help you learn the fine techniques of stimulating language at home or in the clinic, or wherever you happen to be. And one of the wonderful, nice things about it is that you don't need papers, and you don't need notebooks or iPads or any number of external devices. This is something that you can do within a conversation. You can learn how to stimulate your loved one or your client, and you can stimulate them to talk better, talk in single words, phrases, or sentences. My name is Mark Ittleman, and I've been a speech-language pathologist for 43 years. Can you believe that? And in that time, I've trained lots of students and trained lots of caregivers because I believe that these techniques are very, very helpful. I always wanted to get good results, and you will get good results too if you can learn these methods and apply them at home. Because at home, you're there and your loved one is there, or the person with the speaking difficulty, and you can be stimulating their speech and language all day long. You can be stimulating it in the morning, in the afternoon, at dinner time, at all the meals, after dinner, before one goes to bed. In fact, the home environment is very language rich, and by learning the teaching of talking, you can be stimulating your loved one to speak better all day long. Now, studies have shown that those who receive intensive speech and language stimulation tend to improve their speaking versus those who only go to therapy for 1, 2, 3 times a week. So you see, the home environment, and if you're a caregiver or a parent and you're home with the person 8, 10, 12 hours or more every day, or even 24 hours a day, there's lots of opportunities to stimulate language. The more you stimulate language, the better results you'll get. And that's what the research shows. So that's the reason why, if you follow my directions and follow the easy lessons in this Teaching of Talking training module, that you will learn how to stimulate speech and language like a professional. Now, this is not meant to replace any work that you're doing with a speech-language pathologist. However, more and more speech pathologists are learning this method, and then they're training the parents or their caregivers in these techniques so that when therapy ends, they can go home and stimulate speech and language all through the day and the evening. Now, this is also good for those whose insurance has run out, and by doing that, or if people do not have access to skilled care, the Teaching of Talking training module will be helpful for them. About the only thing you really need to know is about your loved one or about the person who has difficulty speaking or your client, is they must be stimulable. Now, what do I mean by stimulable? Stimulable means that they can imitate a vowel sound or a number or a letter of the alphabet after you say it. So if you say a sound or a word or a letter or a number, and if they can imitate it fairly accurately, then this person would be good for the Teaching of Talking technique. Also, what's very important is that the person with whom you are working, they must be able to comprehend spoken language. They must be able to follow simple directions. Simple directions, so, like, can you raise your hand? Can you lower your hand? Can you close your eyes? Can you open your eyes? As long as you speak very slowly and comfortably, these people will probably do a very good job with the teaching of talking method. And so will you if you're motivated. These lessons are on video. You can access them 24/7. You can access them on your phone. You can access them on your computer. You can access them in the middle of the night. You can access them early in the morning. You can access it any time you want. And you can go over the techniques that I've covered with you on the video and then go and apply them. Now, this is Mark Ittleman, a speech-language pathologist, hoping you will take advantage of these modules and learn the teaching of talking method so that you can help your loved ones speak and watch them improve and start talking with improvement. So this is Mark Ittleman. Have a great day. It's been great having this conversation.